Thank you for tuning in into another EKG review here. Today we're going to review atrial fibrillation and these compensatory pauses that frequently happen in patients that are atrial fib. Now let's go into defining what is atrial fib. Atrial fib is an irregular rhythm. At times the heart rate is rapid or the heart rate could be really brady. What's the cause of it? The cause of it is due to poor blood flow. And what is happening in the heart? Well, the upper chamber, the atrial, beats out of coordination with the lower chamber of the ventricle, meaning that there is no coordination with from the upper chamber to the lower chamber. The exchange of blood, of oxygenated or deoxygenated blood, is not coordinated correctly in order for the electrical impulses to contract the atrium and the ventricle the way it should be in the lub-dub rhythm. So that's why it's discoordinated. Now here I have a atrial fib patient, heart rate at 34, and here we have what they call a compository pause, and right now the patient's at 3.22 second pause here. Normalcy of pauses, anything less than 4 is considered normal in an atrial fib patient. Anything more than 4 seconds is somewhat an indication that the patient can potentially have longer pauses and can go into a systole. Now, what is a compensatory pause? A compensatory pause is a result of an ectopic impulse fails to enter into the SA node. Pauses are normal, as I mentioned, in atrial fib up to 4 seconds, and abnormal when they're more than 4 seconds. Now, this is the longest one this patient has been having. As I look through here, the patient has had smaller ones of about 2.75 seconds of their lowest average of pause. How do we know this is atrial fib? We see the fibrillations here. This looks like a P, but then over here we have more a flat line here, which is not really a flat line, but there is fibrillation here. Patients with atrial fib can fluctuate between atrial fib and atrial flutter, which is also known as sawtooth. This rhythm right here, patient's heart rate is at 46 with a 2.75 second pause. Here we have 2 more compensatory pauses, measurements of 2.30 seconds, and the one next door equivalent 2.30 seconds. Thank you for watching, and please subscribe to my channel, and I will be reviewing much more EKG rhythms. Thank you.